Think of cystic fibrosis, systemic sclerosis, hypertrophic cardiac myopathy, or chronic kidney disease. What do these diseases have in common? Apparently nothing, but actually they do share a common underlying condition, which is fibrosis. Fibrosis will be excessive scarring of tissue, so starting from a healthy tissue, they will lead to impairment of the organ function and ultimately to organ failure.
Fibrosis is in fact linked to about 45% of all deaths in the industrialized world because it's a condition shared by many different diseases. It can occur in a variety of organs, including the heart, the lung, the kidney and the liver, and also the skin. It's also a part of diseases such as cancer and endometriosis. There are currently very little to no treatment options for fibrosis. So that's why there is an urgent need for development of novel therapies for which we use a variety of disease models. Disease models are often based on cells or laboratory animals. For fibrotic diseases, we often do not have a very good understanding of how these diseases originate, and that translates to our inability to make good animal models of this research.
Together with my group, we are developing innovative technologies and engineering solutions that we can create miniaturized and advanced models for tissues, organs, and diseases. In our project, FibOoC, we are developing novel miniaturized models of fibrotic tissues without using any test animals so that we can better understand this condition, fibrosis. We are currently focusing on one specific disease, which is a rare disease, systemic sclerosis. This disease is initially impacting the skin, therefore we are developing a miniaturized model of a skin. So the core technology that we are using to build our model is an organ on a chip. So what we do is that we create a miniaturized version of a tissue of an organ in such a device. And in such a device, which is a chip, we have very small structures which will be comparable in terms of size to the dimensions of a human hair, and we can create different types of chambers and pipes in which we can introduce liquids but also the cells.
In the FibOoC project, my role is to combine biological and the engineering perspectives, and mostly the idea for me to design the models here and also to validate here with the cell culture. Also incorporate with some engineering aspects.
We have identified important characteristics of fibrotic diseases which we are incorporating one by one in our model. So what we do in the project is that we will use all these different chambers and structures to introduce all the different components which are essential to build our fibrotic disease model. And the pipes are used to bring all the nutrients and all the soluble factors that the tissues need to remain alive but also functional. So the beauty of our technology, organ-on-a-chip, is that we can build our model in a modular manner. So we can really choose what are the components of the disease that we want to incorporate to really try to understand how these different parameters can influence each other in terms of triggering the disease but also promoting its progression.
In my research group, we aim to develop novel protein-based therapeutic agents for a variety of diseases. And for that, we use non-animal methodologies. We are building models of the disease that take into account the cells from the patient themselves. By this, we do not only avoid the use of laboratory animals, but also hope to get information from our studies, which is more directly applicable to the human situation. Our consortium is broader than the two of us and our two institutes, and also includes rheumatologists and researchers from the Department of Rheumatology at the Radboudumc University Medical Center.
All the research we conduct in our group and all the technologies we develop can contribute in the future to a reduction and a replacement of animal experimentation.
The main motivation to help me to push this project is reducing and also replacing the animal usage from this area. Because we know that the organ-on-a-chip technology is one of the strongest technology that we can replace all this animal usage.
Support Stichting Proefdiervrij and support animal research-free projects like ours. Together, we work towards a better world for animals and people.